was assumed to be the disease for the rich, but the current battle of the disease by many, including the low class, has become a thing of serious concern by many, especially the World Health Organization. It is on this note that WHO has set aside February 4th every year to create awareness and to encourage its prevention, detection, and treatment. Nigeria as a nation was not left out in this year's commemoration, as some non-governmental organizations engaged on street work in the Federal Capital Territory for awareness creation. But to most Nigerians, there is need for more awareness creation, especially in the area of routine checks for early detection.
We don't have enough awareness because, in this part of the world, most times people attribute all those illnesses to witchcraft and all that. So the awareness is not enough. That's the truth. And we need to intensify our awareness. And I think beyond using one day to create awareness, because that's what people do, World Cancer Day, everybody creates awareness. After that, everything ends. It should be a sustained awareness.
I don't think the awareness is enough. Awareness at two levels. One, awareness in terms of prevention. And two, awareness in terms of seeking Medicare at the very early stage. Because part of the problem we see in this country is, unlike what is obtainable in the West, where most cancers present to hospitals in the very early stage and are curable. Over 75% of our patients present in the third and fourth stage, that's in the late stage, when the disease is quite advanced and the cure becomes almost impossible.
They, however, called on the federal government to create treatment centers around the country.
Yeah, government has to really put in a lot of resources into awareness creation, because for most of those illnesses, the main focus is on prevention. But most time when you have it, there's hardly anything one can do, and we all know that prevention is always cheaper and better than cure.
The role of the federal government is to provide treatment centers like radiotherapy. There are very few centers that can give radiotherapy to cancer patients, and also screening centers. If we detect it early enough, it will not kill the individual.
Yes, I think advocacy and advocacy can start from secondary schools, universities, religious leaders, cultural organizations, communities, the media, everybody should be involved.
The theme for 2018 World Cancer Day is We Can. Ikaiti Boot, PTV News.
All right, 2018 means we can, I can, and we all can actually help fight cancer. And a consultant radiation and clinical oncologist in the person of Dr. Obo Evarastus did say that the difficulty in achieving effective treatments for different cancers was still a burden in Nigeria. He said that patient factor and treatment factors were the two key things that made it very difficult focusing on this issue as regards cancer. But aside what the oncologist has said, we have in the live studios Dr. Lars Ude, who is the executive director of Pink Oak Cancer Trust, right here with us to share his views as regards the challenges of treatment of cancer right here in Nigeria. Good morning, nice to have you join us.
Thank you, Anthony.
All right, how was the World Cancer Day? Did it meet your expectations in terms of the awareness and stakeholders coming together to push forward towards helping the fight against cancer?
Yes, absolutely. In Abuja and many cities in the country, there were a lot of activities. Here in Abuja, my organization supported Project Pink Blue in organizing the march that was streamed before we started talking. So, and a lot of persons came out in huge numbers to Transcorp, and it was huge. It was quite huge. And Nigerians, especially those in the cities, are becoming very much aware. They are becoming much more conscious, But majority of Nigerians do not live in the cities, and I can't say the same of those who are living in the rural communities or even semi-urban communities in the country. So the awareness really needs to get to the grassroots, because that's where you have 1,001 misconceptions around cancer, and we really need to get the information there. And the way to get it there has to go through our health system, because the NGOs, are there to just support what the government is doing. They are not to take over the responsibility of government. So government at various levels, be it local government, federal government, state government, have a responsibility to use the civil servants. You have health educators, or every local government should have at least one health educator, and they should use the local community, use their language, the language they understand, to communicate these messages for people to be able to appreciate what they need to do to help themselves.
Okay, she asked a very key question before you came on set. Why are the color pink chosen to identify cancer?
Pink in particular.
Well, pink does not represent the everything cancer,
Okay.
but breast cancer specifically. So I will not be able to speak on why
The color
that
pink.
color
And
was
it's perhaps because
selected.
breast cancer is strictly for ladies. Am I right in saying
Well,
that?
it's
So
not
it's-
strictly for ladies, but it's more common in women.
Okay,
Men
have breast
also have breast cancer.
Really?
Yes, but it's rare in men. But I've seen at least 4 cases of 4 men with breast cancer. And just late last year, I interviewed a man, a survivor for 9 years, who had breast cancer, successfully treated himself, and he's up and doing very well.
Okay. Now let's look at creating awareness for cancer. We know that cancer has been around for so long, and we keep referring to awareness in a futuristic term. Like you just said something now that it will be good for every, when we look at the rural areas especially, for an educator to at least be in one community at a time and all that, But then, if you ask me, it's supposed to be that literally everyone is supposed to be aware of cancer, because it's ravishing our society, it is ravishing the country and all that. So why is there looks as if there's a stalling, or there's a delay, or there's slowness in creating this awareness, especially at the grassroots level? Where
Well,
can we lay the blame?
Well, in terms of knowing about cancer, I think, a whole lot of persons, almost every adult, may have heard the word cancer. But it's not about what the person knows about cancer. For some people, they think it's one spiritual attack that from enemies and all that. For some people, they think it's witchcraft, or first people think it's a curse. But that's not the accurate information. So, why people are not getting to know about the accurate information on cancer is just a symptom of our, health system that is performing below expectation. And when I talk about health system, I'm not just talking about treatment, because most times when you talk about health, people think hospital and what you can get inside the hospital. But, health goes from the prevention, to the treatment, and and the treatment involves different levels at the primary care level, at even the specialist level. So from that prevention aspect, which begins with knowledge, because if you don't have information, accurate information on what to do, the right thing to do, then you might not take the right actions. And also behaviors, so there are some behaviors that are not good for our health. Remember earlier this year when we talked about certain goals and health agenda for the year.
Yeah, yes.
We talked about nutrition, we talked about exercise and all that. Those are things that need to promote good health. So there are some things that we get from food that might be carcinogenic and lead to cancer later in life. So the habits.
Is it possible to tell us some of those things so that?
Well, there are a lot of junk foods around, so processed food. And in the course of handling this, you might have some metals, so, and you have some environmental factors, that also lead to this filthy environment, pollution from chemicals and all that. That's also get into our crops on the soil, so, and the crops derive their nutrients
So the
from
Niger
the
Delta
soil.
area should be a very typical example that might
Absolutely.
possibility of people suffering cancer,
Absolutely, because the petroleum product has a lot of
cancerous components.
chemicals on the ground, and where you also have lead, mercury, mining activities
Activities,
in a
Plateau State could also come in.
way.
Okay,
In
yeah.
a crude way. Well, yes, some of this, every place is potentially,
Potential.
because you can have pollution here, water could wash it off to elsewhere. So if Abuja is polluted, then anywhere in the country is also at risk of such, because it just takes rainfall to move some things from one location to another. Then tobacco, tobacco, which is a habit that a lot of people tend to get into, is a major culprit when it comes to cancer.
Okay.
And you can't talk about cancer without talking about the effect of tobacco smoking, cigarettes, and the different forms of tobacco. Now people are going into the one they call shisha and all sorts of names. So those things,
Is that shisha harmful?
well, I don't know the health benefits of that shisha. So what is best is to keep off all those things, whether it's even though you may not classify marijuana as tobacco, but it also has its own effect on mental health, because some people get mad because of it. So those behaviors are things that tend to promote, not just cancer, but also other forms of health challenges. And people need to know this early enough, even starting from our education system, health education, have some basic tips on cancer, on malaria, on reproductive health, comprehensive sexuality education, all the things that will make someone healthy, so that we pick those things in school: hand washing, cleanliness, hygiene, and not just teaching about it, but providing an environment that makes it conducive for people to abide by those teachings.
All right. The oncologist, Dr. Obo, did raise the issue of patient factor and treatment factor. And in the treatment factor, he made mention of the fact that the inadequate machines to carry out cancer treatment. And also recently, we got the Minister of Health saying there was going to be a national screening across the country because of the issue of lack of equipment. How key is this, and what are the possibilities we're having with these two statements?
Well, the consultant is right. We don't have adequate diagnostic and treatment facilities. It's not as if we don't have at all, but it's not
I heard it just one.
grossly inadequate. Well, it's more than one, but when you talk about the functional ones, like radiotherapy, has a mention. It's not the only way of treating cancer.
Okay, it's different from
But
chemo.
Yeah,
chemo is
chemotherapy.
drugs.
Okay.
Radio is like radiation
Radiation
beam,
beams,
that you use. And you also have other surgery that
Okay.
also require facilities. So all of that are there, but radiotherapy came to limelight, especially last year, when it got to a point that almost none of the available machines was functional. The one at National Hospital Abuja was just reactivated a couple of months ago. So because it was non-functional for a very long period of time. And you also have bone scan. Cancer is not just the diagnostics. You need to know what you're treating. So before you even diagnose cancer, women are encouraged to do self-breast examination. If you identify lump, that's just the lump doesn't mean there is cancer, but it's now a signal to go and see if it's cancer or not. So, and for you to see that, it requires pathology.
So is that where the pap smear?
Pap smear is for cervical cancer.
Okay.
Any part of the body can have cancer.
Wow.
So, and the breast cancer is not the same as cervical. What causes cervical is not the same as prostate for men, in men. So like cervical cancer is human papilloma virus, which is preventable, and you have vaccines against HPV. Liver cancer is hepatitis B that could lead to that, and you also have vaccines that can prevent that. But you don't have same for breast cancer. Colorectal cancer, or that of the intestine, is also a lung cancer. Tobacco is one of the major risk factors, but that is preventable. So you have all that. But coming to facilities to diagnose. You don't have pathologists in majority of the hospitals. You don't even need to have in all the hospitals. But at least screening, we should be able to have mammogram in general hospitals where people can walk in and screen. The minister's plan sounds good, but is it sustainable? And the federal government health.
But the plans, laid out is it? Because all we just hear is the fact that there's going to be nationwide screening. But for you, in details, what were the highlights that you're not very comfortable or you still have some doubts about?
Well, I can't speak for the Federal Minister of Health, so
no, but based on what they've said,
they'll be in a better position to explain the details.
Okay.
So how that, I'm not new to hearing pronouncements. With due respect to the minister and the people before them, you have these pronouncements, well intended, but it's the implementation that I really care about. So I look forward to having people in my village, being able to go for that screening. It's not when it's done in state capitals, all over the place, and we say it's gone nationwide. But I must also recognize that it's not just the Federal Ministry of Health that have responsibility for health. Federal Ministry of Health, their job primarily is policies. Make policies and, go for the biggest things, all these teaching hospitals and all that, and also making the environment conducive for private sector investment in health. Government alone cannot give us all we need. The hospitals that our politicians and our wealthy ones go outside the country are not government hospitals. They are private hospitals. So why can't we as a country create an environment that will make people that have money build some of those facilities in the country, or even those that are available in the country, to make enough money to put in those facilities? We have very good hospitals and professionals in this country, but there's some investment that if you make due to some factors that are not within the control of the private sector players could frustrate your investment, and you will not want to do it. So that's where government needs to come in for some of the catastrophic health conditions.
Okay, when you look at radiotherapy, we know that it can be invasive, can be harsh and all that, So are there certain measures after that treatment that could be taken to prevent? Because I know some people, the hair falls off, skin can be burnt looking for. So are there certain oils or certain preventions? And they're looking at chemotherapy. We know that both abroad and here, the drugs are very, very expensive. Now, why is that? Is it that from when the people, of course, I'm not an authority, so I'm using very layman terms, from when they go into the field to check for the plants that are befitting for the drugs, and they come to check it in the lab, to when it is produced, and all that. What are those stages that really make it expensive? Because cancer is such a dangerous and it's a killer disease. So why not try to make it in such a way that even the person at the lowest level can actually be able to afford it? Why is it like that?
Well, that's a very good question, because funding is a major barrier when it comes to cancer care. You mentioned about how do you prevent some potential side effects of radiotherapy. There's the side effects, the experts have been trained on how to prevent that as much as possible. But things like hair loss and all that are things you can't do without. It comes
That's
with...
not preventable.
Yes. So, but patients are counseled on what to expect. Whether it's radiotherapy, because these are very strong medications. The cancer cells are crazy, so and you need a very powerful medications to get them off. And some of these drugs don't differentiate, because one thing with cancer cells is that they are rapidly proliferating. That's, they divide very fast. Do you understand? So and some body cells also divide very fast, like the epithelial lining, the linings of the intestine and all that, and even the hair cells also divide very fast. So when these drugs are suppressing or eliminating the cancer cells, it's also affecting other cells of the body that proliferate very rapidly. So, and that's what, but those things are temporary.
Okay.
They are temporary, because when the cancer goes and you stop the medication, the person still, those things still grow back. So people are usually counseled on what to expect so that they won't be surprised. And professionals have been trained on how to prevent them as much as possible. But coming to funding now, is people tend to cling to all these misconceptions because they don't have money. So that's a major reason.
Can you take me back? What do you mean by misconception because they don't have money?
Certain misconceptions that okay, this is a spiritual attack and they go to religious houses for treatment.
People that don't have that misconception and it is really expensive because
Yes.
not everybody has that funny belief.
Very
but
good.
It is expensive.
It's expensive. There are key drivers of the cost. One is these drugs are expensive anywhere in the world, but how do we make it affordable? We make it affordable because for many catastrophic health expense, in many countries of the world, governments come in. In the US, for instance, health expenditure is the commonest cause of bankruptcy. And in this country, many people become poor from cancer, treating kidney failure, treating all sorts of health conditions that come, and in many cases they spend that huge sum of money and still lose the patient. So is where that the big government need to come in. I would prefer local government and states to concentrate more on screening, and the federal government to focus more on funding for cancer, especially health insurance that will make people not go bankrupt because they have cancer. And when people are trying to raise money and time is going, the cancer cells don't understand that they are trying to raise money and say, okay, let me wait. It keeps multiplying.
Yeah.
And so something that is still at early stage when it can be treated and cured, because cancer when it gotten early can be treated and cured. And there are so many persons who have survived cancer. I was very excited when I saw Mr. Sadiq Daba, the very popular Sadiq Daba, and broadcaster, and he was part of this march. He's still undergoing treatment, but it took well-meaning Nigeria. It took outcry of someone at that level, with his contributions to this country, and there are so many people like that. It took outcry for well-meaning Nigerians, some influential persons to bring money, and he's receiving treatment. Without such intervention, he will probably not be with us at the moment, but we are glad he's with us. But how many persons do we need to be doing social media or coming on TV or radio to beg for alms? The cancer cells will not wait. And, part of the solutions, because I believe what is sustainable is for government to provide health insurance. Some people have advocated for catastrophic health fund, where government will provide certain lump of money that could be used on the interim, to support people with these health conditions. Countries like Gambia, Kenya, and all that, Tanzania, get to do this. Rwanda, they don't leave their citizens to bear this cost alone. That's the essence of government for this kind. In the UK, everybody has health insurance. Why can't we have that? With the level of poverty in the country.
How certain are you that health insurance could be the key? Because recently, though, we have Trump says a lot of things. He's saying the UK National Health Scheme is currently broke and not working. You now look at Nigeria. Do you think Nigeria can afford to put cancer treatment within the health insurance scheme, which can barely pay for some secondary care that is not falling under cancer? How realistic do you think that is? And do you think the present-day government sees or appreciates the need for such a very big venture?
Well, I think we can do it. The health insurance we currently have, National Health Insurance Scheme, as became functional in I think 2005. That's over 12 years ago. And if you ask the question, one of the most difficult questions for them to answer is how many Nigerians are covered? Have the executive secretary, the one under suspension,
Sure.
the acting one, have been asked this question. I've asked, in some occasions, and the response you usually get is about 5%, about this, about that, and that's where the problem is. Ghana, that started their health insurance about the same time, over 70% of their citizens are covered. So what we need is not this paltry insurance scheme that we just have federal civil servants covered. We want every Nigerian to be covered, universal health coverage, and we can work out what works. Do you understand? The UK system may have some challenges in the funding, but we will learn from their own challenges and design what will work for us Nigerians. Every citizen of the country should have health insurance, just as every car is expected to have health insurance.
Is the caregivers, the hospitals now, are they not one of the major problems, especially the medical doctors? Because I worked in the health insurance scheme for 7 years as marketing the health insurance, and the issues enrollees always have is you go to this hospital tells you we don't like doing health insurance because they don't pay them, they want the monies, they want fee for service, which is what we're trying to avoid technically by having health insurance. But the hospital is demanding for fee for service and saying, okay, we're not going to cover terminal illnesses because they got a lot of our consumables and all that. Is that factor not still too strong for us to delve into it?
It's not. You identify the problem that the insurance companies or insurance providers, they are not paying. This is about, if you have any hospital, whether government or public, they run on funds. So, and the idea of health insurance is to pool funds together. You contribute, I contribute. Some people get ill, others may not get ill. So you use the money and treat those that get ill. Yeah. So, and when a health facility provides care for patients and they're supposed to be reimbursed and the money is not coming, that's where the problem is, not the doctors or the hospitals. Do you understand? The hospitals also have their own problem, but when it comes to the financing, it's the responsibility of the HMO or NHIS or whoever is paying to pay in good time, because they need money to provide the services, they need money to put things in place. So if they are not paying, how would the hospital run its own system of procuring drugs or procuring reagents to use for even others who are paying? So these are important. The job of the hospital is to ensure that the highest possible quality of care is provided. All these things, the problems are known, but there are solutions. There are a lot of countries that run universal health coverage, and it's working out well.
What would be your ideal strategy to improve financing of health insurance and cancer treatment in Nigeria?
The ideal strategy that is sustainable is universal health coverage. But while the country works towards that, there is something that, in my organization we're currently working on, the Pink Oak Cancer Trust. We are mobilizing resources from corporations, their corporate social responsibility, and individuals like you. I'll come to you guys.
Do companies do that anymore?
Yes, they do. Okay. Nigerian companies do. It's just that most times they put their money on tangible things where you can go and cut tape and commission and show on TV and stuff. But they do. A number of them support NGOs in funding this thing. So we want to get more of that. Put the resources together, and we're working with NGOs that are doing cancer awareness and all that. And I'm going to be coming for you guys to donate to these funds, so that from there the NGOs come with the patients, they pay 25%, and Pink Oak Cancer Trust pays 75%. So, but this is a temporary solution.
So how do you get the 75% on your own path?
We get the 75% because we are going to meet people's TV, and people's TV will pay, will give us like 20 million.
Our role of putting you up there in the media, is that not...
It's part of it, very important, and I appreciate you guys for that. But I just use people's TV as an example. But corporations, we put money in it. We approach them. We will even start that very soon. And individuals through crowdfunding, 100 naira, 200 naira. Imagine 1 million Nigerians putting in 100 naira. That's 100 million. You can treat, for instance, up to 20 persons, for instance, depending on the type of cancer. We can provide support for those ones. But if you look at the number of people with cancer in Nigeria, vis-a-vis this solution, that it can't get to everyone. So, but
what's the average amount of Nigerians suffering cancer?
Well, the data we have up to 100,000 Nigerians, get the diagnosis on annual basis.
Okay.
So different types of cancer. So cervical has its own. Breast cancer, of course, is the most common. So you have cervical, you have prostate, you have colorectal, liver, lungs, everywhere. So yes, but most of the cancer in the brain are secondary cancer. That's the cancer is in another part of the body and
just
gets
affecting
metastasized to the brain. So that's how it goes. So we want Nigerians, we need to be our brother's keeper to begin to donate to win cancer. Anyone, I've come across a whole lot of persons that have lost their parents, their siblings, their friends, their close associates to cancer. The simple commonest stuff is it drains them, it drains the family. It drains the family. And while you are putting in all those money to save that life, others are suffering. If you have children, they will be getting malnourished, and people's school fees, others that need to go to school. So, and most people that cancer kill, it kill them in their prime. These are people who are working, who are doing business, who are contributing to the economy. And it's not good for our own economy that we lose, men and women who are middle age making huge contributions to the development of the country, and cancer comes and take them away and change the course of their family. So we really need to do something as individuals in passing the right information and also donating to win cancer, and government to put to make universal health coverage possible, to cover not just cancer but other diseases that are very high, like kidney failure, like not just liver failure, so many of those other health conditions.
Now, when you look at the rural areas, right, most times they tend to be ostracized. Probably not deliberately, probably because there's a scheme, and before it gets to them, some level of damages have been done. So, to you, how will you rate the awareness created for cancer in the rural areas?
Very poor, very poor, very poor, and raising the awareness, like we are on people's TV. So it's people who can afford cable, for instance,
areas,
that will watch it. So even those in the urban areas, if they can't afford the cable, they may not be able to watch it. And even when they have the cable, they need electricity to be available before they could listen to what we are saying. So, but in the rural communities, radio penetrates so much. So, and every state in this country have radio. It doesn't cost them anything, to use radio to pass information,
So
because radio is cheap.
On that. The rural people, they should get radios.
Yes, some programs happen.
Literacy is also another challenge, right?
Very good, but you also know in states, for instance, let's take Kogi State that is close to us as an example. If you are talking on radio and you're using English, certain population have been alienated. And okay, if you use the Gala, certain population have been alienated. So the health education is best taken to the grassroots level. Of course, on radio, you use the commonest languages, or as many as you can, especially in states that have multiple languages. But at the rural community, you should also have people from in the local government system. The governors, with due respect, have bastardized the local government system. In most states, they are not just functional. So all these, you have health departments, you have supervisory councillors for health. You should have people who will bring together town criers, educate them, let them go to their village. If they are doing community days or activities, of course they exist in a number of places. So they use this to pass the right information in the local dialect that the people will understand.
I think that should be looked into seriously.
And even religious houses, could also be channels to deliver some of these messages.
All right, let's just wrap up this cancer talk, and then we'll focus on the female genital mutilation, which happens to be today, International Day. On the final note on cancer, what will be your quick takeaways for the people watching, in order not to think that once you've got cancer, it's a death sentence, you're not going to make it? what are the key things that the people out there should know in terms of early detection and the fact that it can be treated and cured? And even when you're treated, it means you still have life ahead of you.
Absolutely. Yes, the takeaway here is cancer is not death sentence. Any form of cancer,
Okay.
if it's detected early, it can be cured. Even in some cases, if detected late, you can still, elongate life.
What's the time frame of this detection and
Well,
possible
the
treatment and cure?
the detection best, cancer have stages
Okay.
1, 2, 3, depending on the
Okay.
type of cancer.
Okay.
So the best that there are some cancers that are very hidden that you have little control. But thankfully, those cancers are not very like pancreatic cancer.
Okay.
The pancreas is inside
Yeah,
the abdomen and is hidden under some organs. So and when it begins to show symptoms, it mimics ulcer and other diseases. So most times when you find out it's cancer, it has spread
Right.
already. So but that kind of type of cancer is not very common. But the very common ones like breast is external. You can feel a lump. You do self-breast examination. You see a lump. Not every lump is cancer. In fact, most of the times, majority of the cases,
teenagers
yes.
in terms of girls begin to
Yes.
do breast check it out. Okay.
Yes, they can, but for teenagers, most times the commonest lump in girls, teenage girls, is fibroadenoma, which is not a cancer. It's not a
Okay.
malignant tumor.
Okay.
So, but the thing is, you see a lump, it's not normal. If you're also a woman, especially after menopause, and you are bleeding, or even before menopause, if you are bleeding, any bleeding that is not menses, if it's before menopause, we call it intermenstrual bleeding. That's
Okay.
between menses, you see blood. Go and see a doctor. Know what it is. If it's after menopause, you shouldn't even see bleeding at all. If you see it, see a doctor.
But some
But
menopause
regular
are extended.
screening and checks help. To get some of these things identified.
Okay, so sometimes in extended menopause, it's just too good to go and check. Just
Yes.
When you say extended,
to check.
what's the time frame
Above
for the
45.
extend? Okay.
Well, you have range. Some
Okay.
people at 57 may still be seeing their menses, but
So
there are
does it
certain
mean
changes.
those people can actually have kids they can conceive?
Of course, but it's not very common. But
Okay.
you still have folks at that age. So cancer, the point is that it's preventable.
Okay.
Avoid smoking, do regular exercise, eat natural, predominantly natural, balanced diet, food. So but no matter what you do, there are still some cases that it may come because there are some cancers that you can't really say, okay, this is what is causing it.
Okay.
So, but you have risk factor. But if you catch it on time, you get it done. And we need everybody to become advocates. Don't wait for it to come to you. Let's all become advocates. Let our government, we always say, because if there is no need for government, we won't have one. So we have our roles to play as individuals, but we also need to hold government accountable.
All
And
right.
that accountability is, election is coming. Let's know what those who want to contest, what they want to do about cancer and health financing in general. Because health is treated as charity, do good. But health is business, is beyond doing good for the people, is also business. So let the enabling environment be provided. Health is not cheap. Anything you are getting free, someone somewhere is paying for it. Health is not cheap anywhere in the world. So we need to provide health insurance that will cover all Nigerians, that will cover all these conditions. And from there, and we also need the business of health where private sector will come and put up all these big hospitals so that our president and so many others will
going
not
out of
need
the
to leave the country,
Well,
to
they
get
can actually
get
go so
treated.
that we have enough space for
No, they
other
can go
Nigerians.
on their money, but not on public funds.
Public funds.
So at least for public funds, let's not have reason to use our public money.
Yeah.
Nobody knows how much, but that's topic for another day. But if you check perhaps the amount government of Nigeria spends, that's the information we as citizens should be asking for. How much has been spent in the last 1 year in sponsoring public officials to seek medical treatment abroad or even medical checkup? If you know the amount it is, you know that amount, if used and invested in health insurance, may even be able to provide insurance to over 50 million Nigerians. that was just expended on maybe less than 500
Yes,
Nigerians.
and so don't also forget the service charge for the planes parked there, because there's a certain fee they park every day, so that is still public funds.
You know, so we just need to be, and most importantly, let me also do still on the title to say you could donate to Win Cancer and donate to Pinko Cancer Trust. I know they will not ask me for money for this.
Okay, we're going to definitely get him charged for that. We'll go for a quick break. When we come back, today is the World International Day for Zero Tolerance for Female Genital Mutilation. So that will be in the next talk. And we'll still be having Dr. Lars in the studio to help us look at that particular side of the health sector. Then we'll be wrapping up for today. All right, welcome back. If you're just joining us, you're watching Africa's finest breakfast show, Newday, on People's Television. My name is Anthony Momodu, and still here with my co-presenter, Hemba Don Bande. And we've got Dr. Lars Ude Eze, who is in the live studios with us and has put us through as regards cancer treatment in Nigeria, the challenges and the way forward. He is the ED of the Pink Oak Cancer Trust, and they've been doing great things trying to help Nigerians win cancer, so to say. But now it's time for us to look at, today is the International Day for Zero Tolerance against female genital mutilation, and we're looking at how to stop it. It's been said that over 200 million girls and women in the world today would have gone through that very harmful practice. And the United Nations Secretary General, talking about Antonio Guterres, has said, knowing that the dignity, the health, and well-being of girls all over the world needs this attention, it means that we have to quickly, as a matter of urgence, to join hands together to see how we can stop this harmful practice. And it's said that in Gambia, 56% of girls have suffered that, followed by Mauritania with 54%, and that tells us that it's alarming in the African continent. And coming down to Nigeria, he is the man who has done a lot of work around this, talking about Dr. Lars, and that's why we're so glad to have him in the live studios. So how terrible is it when it comes to female genital mutilation right here in Nigeria?
Well, it is a practice that shouldn't be in 21st century. Yes, it didn't just start now, it started many years ago. Yeah. And those who started it may have good reasons.
Yeah, they have one reason, saying that it makes the women not very promiscuous or very excited. But science proved otherwise. Am I right?
Even not just science. From what we could see, there is no evidence that gave credence to that. So that's why I say good reasons in quotes, okay, for starting it. But over time, we don't see any benefits. In fact, the reverse is the case. Because the clitoris, the part of the female genital organs that they usually cut, is the most sensitive, part of the sexual system in a woman. Just as the glands of the penis, the tip of the penis is for the man because of the cells that are there. So the thinking of those is, okay, if you touch the clitoris, the woman could have sexual urge. Okay. So if you cut it off, the tendency of having this sexual urge will be eliminated and may not have. But that was the thinking. But look at the reality. The clitoris is cut off, and sometimes in the process they cut off other things they did not intend to cut. And when they cut off the clitoris, and during sex, it's meant to be enjoyed. God knows why He put it there. You know, so so during sex, the satisfaction doesn't come as much as it should. So when the clitoris is cut off, the person will need more sex to get satisfied. So
it achieves the opposite.
It achieves the opposite.
So
you know, so the person will want to stay longer
eventually they
to reach
can
orgasm.
get satisfied. Is that what you're saying? They can.
They can, but to reach orgasm, you know, longer sex is required.
Okay.
You know, so, and if, for instance, is a woman that is married and feels the husband is not staying long enough to provide that satisfaction, it begins to look for somebody somewhere
So
who will probably take one drug somewhere that could make him stay 4 hours or something, you know, to get satisfied.
So in the first place, the whole idea of the mutilation is already defeated.
It is defeated as far as I'm concerned. You know, so what are these things? FGM, female genital mutilation, has no benefit. Do you understand? What I know very well is the complications. You know, the complications from the point there was a project I implemented before I started my work on cancer, on female genital mutilation, and we went to schools.
Which axis was it? Which part of the country did you do this?
We did it in Ebonyi State. Ebonyi State which is my state as well. Is the state that has the second highest prevalence of FGM. You know, Osun State has the highest, followed by Ebonyi, followed by Ekiti, and I think Imo and all that. So in Nigeria, from the National Demographic Health Survey of 2013, you know, the states in the south, FGM practiced more in the south than in the north. So if you go by geopolitical zones, southwest, southeast, south, before you begin to go and this is embedded in the tradition. You know, sometimes they say they are doing some traditional rites for young girls into womanhood. It's during that time that they go and cut them. So they go into a place, they have people that do the cutting, they do all that, and they will come out and dance and do all those things. And many people don't know that that's part of the things that they get to do during those rites.
So this thing is still very much prevalent.
It's still very much prevalent, but there's been efforts, deliberate efforts by, government, some state government, the federal government, development partners like UNFPA, some NGOs, trying to create more awareness around this and trying to bring it to a stop. For instance, in Ebonyi State, the Izi clan, which is, one of the major blocks within the state, the wife of the governor, working with a number of development partners, and were able to get all the traditional rulers in that clan to publicly proscribe female genital mutilation. And this happened, was it in June or July last year?
And they did it?
June last year, yes. And
was it successful?
Of course, if you are doing government policies and speaking on radio, most time it doesn't work. It's the one done at the grassroots. They came to their community town hall. I was there. They came to the community town hall. All the traditional rulers, all the communities, their representatives, their elected officials, the wife of the governor was there, the commissioner, government officials were there, and they made a public proclamation that this practice, because that part of the state is largely responsible for most FGM carried in the state, so they said this is no longer our tradition. We are abolishing it. And anybody that is seen to carry it out, you bring goods, you bring all those.
That work so quickly. So quickly.
That and the state's assembly was still considering a legislation to ban FGM. But one thing was known that FGM is illegal in Nigeria. The Violence Against Persons Prohibition Act, enacted and signed into law in 2015, bans FGM, female genital mutilation, and anybody that does it can have as much as 4 years imprisonment or a fine of not less than 200,000 naira. It's much for people who get to do this. That's a lot.
Now, when you
know.
look at FGM, that practice, actually using certain blades or certain materials or
Crude
items to, yes, the crude
tools,
nature of it and
yeah.
all that. Now, what is the after effect? First of all, the dirty things they use, probably. What is the after effect on the women? Are there certain health hazards? Does it affect them mentally, emotionally?
Yes, there's a whole lot of effect. You have the immediate ones.
Okay.
When you want to do any surgical procedure, most times you put anesthesia,
Yes.
something that could
Yeah,
make it
yeah.
not to be painful. They don't do that. So when they cut, there is pain, and that pain may not just start and end then. Some live with it for a longer time in their
becomes
life,
mental,
and they'll be
yeah.
having painful intercourse.
Wow.
So there could be bleeding, and that bleeding could be so excessive that may even lead to loss of life. So there could be infection. So because you're talking about a delicate part of organ of the body,
Yeah.
so from there the infection could go up there, even to the womb, and cause a pelvic inflammatory disease or any other type of infection of the genital organ.
So could they have complications during childbirth?
Absolutely. Absolutely. In fact, it's a major cause. I met a woman, a teacher, because we did sensitization of teachers on FGM. And a teacher gave accounts, and in fact, some of them started saying, I was caught. That teacher said she was caught when she was in primary school. So she was already conscious. Many people were caught when they are before the age of 5 or before the age of, so she was already caught when she was in primary school. Some people get caught during child delivery or when they are pregnant. Yes, so she was in primary and she knew it was very painful for her. She was forced. They bring
Right.
able-bodied men that will
So
come
forced.
and hold.
Okay,
and
I would like
force
to
it.
make
Force
some
it.
correction. DG, if you can hear me from the MCRO, it's a female genital mutilation, not just female mutilation, female genital mutilation. DG, take the correction and make it on the screen. Female genital mutilation is the topic. You already said the implications for this crude practice. Looking at human rights, does it violate the female or the human right of the female gender?
Yes, it does. And before I speak further on that, that of childbirth can actually cause obstruction.
Okay.
So that woman said when she wanted to have her baby,
That's dilation and
yes, because when you cut those places, it heals. If you have a scar on your skin, you see that, like if you have a scar over here, you see that you can easily flex this
Yeah,
place,
yeah,
and you
you
have
can
some
flex.
restriction because it reduces the elasticity of the skin, and that happens anywhere you have injury in the body. So when they cut that place, it heals by fibrosis. It reduces, and when the baby is coming out, the womb and all those organs, that the muscles, they tend to extend to allow the baby to pass. So with the cutting, it's the extensive cutting. There's one they call gishiri cuts, somewhere around Abuja here. So extensive cutting like that makes that healing and will not allow the muscles to extend enough for a baby to come out. So it can lead to now having surgical delivery, cesarean section, and that was the case in that woman. And she felt the pain. The mental health is, absolutely affected. They feel less human. The human rights, yes, is a violation of the rights of a woman.
Okay.
Because why are we not even cut men's penis?
Penis, yeah.
Those that are going about raping people and doing all sorts. Okay, let's also cut their penis to stop them from being promiscuous.
Promiscuous.
So it's a form of gender discrimination.
All right. Looking at the way it is now, knowing that it's against the human right and also gender discrimination, how easy do you think it's going to be for us to try to force it? Because we know that 77% prevalence in the South, like you rightly postulated initially. How can we push it out? Already you said the Ebonyi State's model was a very good one, where the state governor's wife, she was laughing because she felt for her to be able to bring those men and for them to denounce it.
That's the power of
there was-
political will.
Yeah, behind the scene. Can we have that political will in other states too? How possible is it?
Yes, it's something that needs to be demonstrated. This problem can be solved from
Okay,
the top.
okay.
The top have done their job.
job.
Abuja has done a law that says this is illegal.
Okay.
But our constitution is in a way that when National Assembly does this kind of law, it's not automatically applicable in the states.
They have
so
to domesticate.
They have to domesticate it, and that's what is being pushed. I don't know if any states have domesticated that act. So, but this is local because it speaks to you. Don't have to tell people, oh, your culture is bad or your tradition is bad. They will resent it. So is to communicate it rightly at that level for them to know there's nothing wrong with your culture. Those fathers or great-grandfathers or ancestors that started this had the best of intentions, but this is the evidence we've seen over time. And you get people in the community, many times these women are usually so scared to even talk. So, but it's a process. You get people to even tell their stories, what they feel. Will you want this on your daughter or your wife or anybody around you?
So you can win their empathy.
Yes, and you get them to use. It's more effective when a community said you were going to bring a cow or goods, and you not attend community events if you are seen to be supporting or carrying out female genital mutilation. It's much more effective than even you do one law and we are speaking English in the media, and which police is going to go and arrest them at the community level. But the community will have enforcers, and nobody dares go against that. So it's actually the way to go, and the state governments and local governments can help to make that happen.
All right, that's how we call it a wrap on today's edition of the program, New Day. We want to say a big thank you to Dr. Lars Ude Eze, who has been awesome this morning, taking us through from cancer treatment in Nigeria, the challenges and the way forward, and also today being the International Day for Zero Tolerance on Female Genital Mutilation. And in Nigeria, we know that in the South it's prevalent, but we're hoping that with the Ebonyi model, things can be done. I want to say a big thank you to the Pink Oak Cancer Trust for the good work they're doing already. And my name remains Anthony Momodu, saying thank you for joining me on Africa's finest breakfast show. Good morning and see you tomorrow.